When you are dealing with long-term effects of COVID, the last thing you want is a health insurance company making the calls deciding that you don't get the treatment that you need to get better.
That's what happened to a local grandmother until Call for Action stepped in.
On January 4th, I started a posting on Facebook.
Tanya Williams
COVID is hitting our family hard.
has much of the last 3 months memorized.
Mom is in the hospital. We'll keep you updated. Day 20,
Full dates
January 24th.
she can recite
Day 38, COVID.
with devastating precision.
Today she was moved to ICU and not doing well.
A daughter documenting
I can't even put into words what the virus is putting our family through.
how long it's been since her mother has been in the hospital.
Mom's one of the strongest people I know, and my heart is in pieces.
Tanya keeps track of her mom Karen's condition and updates family and friends on Facebook.
Day 61. It is now time to transfer Mom to a facility where they specialize in exactly what she needs to bring her back home.
Lately, those updates include her health insurance company,
Day 67. Still fighting Aetna.
who continues to deny Karen's transfer from the hospital to a long-term care facility for rehab.
It's probably one of the hardest things I've ever been through. To see her lying in a hospital bed, not getting the care that she needs to come home to us. It's very disheartening. And knowing that an insurance company is what's holding us back.
Difficult for a daughter.
We've been married 58 years.
Heartbreaking for a husband.
I try to get up there when I can. But it's hard to look at her like, you know? It's very hard to look at her.
Karen's doctors have written referral after referral, met with refusal from insurance company Aetna. It denied her rehab transfer 3 times.
We will continue to advocate for my mom's care.
Daughter Tanya,
She deserves this.
appealing
She will be that miracle.
each time.
Mama's a fighter, so much to live for.
It's extremely emotional.
What exactly are health insurance companies required to cover when it comes to COVID-19? We asked Wisconsin's Office of the Commissioner of Insurance.
Insurers are required to cover the vaccines and diagnostic testing.
Those are directives straight from the CDC. Treatment, though, is trickier. The OCI sent out a bulletin in December strongly encouraging insurance companies to remove barriers like out-of-pocket payments. But that's just a recommendation.
We put in place requirements when we can, and we strongly encourage when we don't have the ability to require something to be done.
Still, not too many folks are finding fault with their health insurance companies, or at least they're not reporting it. An OCI open records request only found 18 documented complaints over the last year, inspiring the OCI to issue this reminder.
We're a resource. We know this is tough for a lot of people. It's very emotional, and we're here to help.
Day 45. Toughest days of our lives. Just having to give the news to my dad daily, to give the news to my family members when it's not a good day, it's really tough.
On day 104, Tanya Williams is still keeping track.
And sometimes I might leave a little bit out to save them from going through this, like I've had to.
But the calendar will soon change. After we contacted Aetna on behalf of Tanya's mom, the company reversed course and approved Karen's transfer to rehab.
Day 69, my dad visited my mom today, and he told her to open her eyes and look at him. She did.
The family now waits for an open bed in her new facility.
We just need her home.
Until then, daughter and dad
All I want to do is get her better and get her home.
will keep
We want to have a few years together yet.
counting. Now, Aetna tells us it denied Karen's first few transfers because they weren't deemed, quote, medically necessary. A spokesperson says this latest approval is because of her progress at the hospital. By the way, if you're fighting with your insurance company, the OCI wants to hear from you. Find a link to file a complaint and the number to call up on channel3000.com.